Recognizing and responding to suicidality. Welcome, everyone. Today, we'll briefly cover how to recognize and respond to suicidality in behavioral health settings. This 15-minute overview equips you to respond calmly, compassionately, and in accordance with protocol. Every interaction is an opportunity to save a life. These objectives help us focus on awareness, response, and communication. The goal isn't to diagnose, it's to detect and respond early. By the end of this training, you will be able to recognize warning signs of suicidality, identify risk and protective factors, respond effectively and safely, follow documentation and reporting protocols. Suicidality can appear in many forms. We often see a gradual escalation from passive wishing to active planning. Recognizing this continuing helps us to intervene early. Understanding suicidality better. Suicidal ideation, thoughts about wanting to die or end one's life. Suicidal intent is the desire with a plan or means. Suicidal behavior, any act towards self-harm or death. Suicidality exists on a continuum. Warning signs are often subtle. Pay attention to sudden changes, verbal cues, or shifts in mood or energy. Staff observations are crucial. Some of the warning signs may include behavioral, talking about death, giving away possessions, withdrawal, increased substance use; emotional, it would be hopelessness, agitation, sudden calmness after distress; cognitively, feeling trapped or like a burden. Risk factors don't predict suicide but highlight vulnerability. Always combine risk awareness with directed communication and follow-up. Risk factors may include previous attempts, mental illness, depression, bipolar psychosis, substance use, major losses, trauma or abuse, isolation, lack of support, or access to lethal means. Protective factors act as buffers. Strengthening these through connection, therapy, or environment reduces risk. Protective factors may include supportive relationships, sense of purpose or belonging, faith or cultural beliefs discouraging suicide, access to care, and restricted access to means. The best tool we have is honest conversation. Asking directly shows care and reduces shame. Always ensures safety first. How to respond. Stay calm and present. Ask directly, are you thinking about killing yourself? Listen non-judgmentally. Ensure safety, do not leave the person alone. Notify clinical supervisor, nursing, or provider immediately. Activate emergency or crisis protocol. That includes 911 or the on-site response team. Document all actions and statements in quotes. Accurate records maintain compliance. Avoid false comfort or minimizing the client's feelings. It's okay to say, I'm really glad you told me. Let's get you help right away. What not to do. Don't promise secrecy. Don't minimize or argue. Don't delay contacting help. And don't offer false reassurance. Even if you're unsure of severity, act as if risk is very high. Err on the side of safety and communication. Your immediate actions should include staying with the client, contacting clinical leadership, initiate suicide precautions, remove harmful objects, begin risk assessment, and document observations and interactions. Documentation is a legal and clinical safeguard. Write clearly and factually. Avoid assumptions or opinions. Documentation may include the client's statements verbatim, in quotes, observed behaviors, risk level and safety plan, notifications made, and follow-up plan. Responding to suicidality can be emotionally taxing. Seek supervision and care for yourself after critical incidents. We have support and debriefing. Suicidal crisis affects staff too. Debrief with your supervisor. Utilize peer support and practice self-care. Key takeaways. Every interaction matters. When we connect, we give clients space to feel seen, valued, and safe. That connection can be life-saving. Ask directly, stay calm and listen, ensure safety, notify and document, and connection prevents crisis. Thanks for listening.